Bismillahirrahmanirrahim. This is Dr. Razia Hussain. Today we are going to see how a peripheral vein can be cannulated. What is our learning objective? In combination with supervised accredited practice, the successful student should be able to place an IV cannula in a peripheral vein whilst demonstrating a safe technique and minimizing the risk of needle stick injuries to one's own self or to others. Now, when do you need to cannulate a vein? Maybe you want to administer IV fluids or you want to give certain drugs like antibiotics, anesthetics, sedation, painkillers. Now, how do you select the gauge and length of the cannula? The principle we follow is smallest gauge and shortest length for whatever purpose you want to cannulate the vein. Now, here is a chart which is showing. Now, what should be the principle of selection of the gauge of cannula? You should select the smallest gauge and the shortest length cannula for the purpose for which you are cannulating a vein. For example, if you want to give a very high flow rate, say 350 ml per minute, which may be required maybe in a trauma patient or where you have to give fast, large volume replacement, then you can select a 14 gauge cannula or a 16 gauge cannula to which you can give a flow rate of about 198 ml per minute, and that is used say in trauma patients where patients are going undergoing major surgery, then in obstetric patients, and where you have GI bleeding. Normally, an 18 gauge cannula is inserted for giving blood and blood products and also for delivery of irritant medications. 20 gauge cannula can be used for maintenance fluids, for giving analgesics, antibiotics, and the rate at which uh, the fluids can be dispensed is about 65 ml per minute. Then likewise, in children, you use a smaller gauge, say 22 or 24 in pediatrics and neonatal patients. Now, this diagram is showing the veins of the forearm. You can select uh, any one vein which fits according to the size of the cannula which you have selected and which is more visible. Again, another diagram showing the veins of the forearm and hand. Now, this diagram or picture is showing just a simple venipuncture. So here we are not using a cannula, but it's just a hypodermic needle with which probably the person is trying to withdraw blood. Venipuncture is just a single prick and you don't retain the cannula or the needle in the vein. You just prick, remove blood, or give drug or whatever the purpose, and then you remove it immediately. Now, what is the gadgetry required for intravenous cannulation? One is gloves, then different size cannula. Different range of cannulas should be available, and you should have one size smaller or bigger cannulae in case you are not able to cannulate with the one which you have selected. Then there should be a dressing to secure the cannula, cotton swabs to wipe out any blood, or and alcohol wipes to clean and prep the site at which you are going to cannulate, and a sharps bin. Now, what is the gadgetry required for cannulating a vein? First and foremost, you should have gloves which you are going to wear, then cannula with size which you want to cannulate, and a spare one also, if present, would be better. Then dressing to secure the cannula, cotton balls to wipe out any blood or fluid, then alcohol wipes, that is to prep the part or the skin uh, at the site of the cannulation, then a sharps bin to dispose of the needle, uh, syringe 5 or 10 ml to fill saline for flushing. Now, this is the assembly of all the gadgetry which we are going to require. These are the gloves, the danger box, cotton swab, saline, tourniquet to tie before cannulation, then swab, prep, everything assembled in one kidney tray. This is a good way of starting to cannulate, because if you just don't assemble all these things together, then you might have a problem. Now, coming to the procedure, how do you cannulate? First and foremost, you have to, when you go to the patient bedside, you have to introduce yourself and tell the patient what you want to do and take the patient's consent. Here, the consent is not written, it is just a verbal consent. Okay. Then you apply a tourniquet, select the site. Where will you apply the tourniquet? The tourniquet has to be applied at the arm, that is where a single bone is there. Then, and tie it a little tight so that the distal veins become prominent. Then, after tying the tourniquet, you select a suitable vein and feel whether you can feel a firm and bouncy vein, and then you release the tourniquet, go and wash your hands, wear gloves, and after that, again apply the tourniquet and take the cannula. Now, what are the things you should take into consideration while cannulate, selecting the site or the arm to cannulate? First and foremost, don't select the dominant arm. Avoid it, because you need to cannulate at a place where the patient can be comfortable, and also he can use his arm, dominant arm, to perform the routine activities like, say, eating, drinking, or he may want to uh, hold something. So it's better to avoid a dominant arm. You should not select the vein, the skin over which is infected or bruised. And if you feel the vein and it is thrombosed, don't select that vein, because you might fail in cannulating. Do not select a vein which is already pricked, because if one has failed to cannulate a vein, then you also may fail to cannulate the same vein. And besides that, the vein may be thrombosed. If any lymph node dissection has been done, like in CA breast, if on one side lymph node, axillary lymph node dissection is done, It's better to avoid that limb because we do not want limb stagnation and uh, edema of the arm. So that's, in fact, one of the absolute contraindications of intravenous cannulation. And if there is an AV fistula on that particular limb, please avoid that limb. After tying the tourniquet, making the vein prominent, selecting the vein, you have to clean the site with a prep. Usually, we are using an alcohol swab. After cleaning with an alcohol swab, you have to stretch the skin or tether the skin over the vein. Why do you do this? You have to stabilize the vein underneath the skin, because if the vein keeps moving, then you will not be able to cannulate easily. So we have to fix the vein under the skin by stretching the skin and stabilizing the vein. Then hold the cannula, and in your in between your index finger and middle finger, the way it is shown in the picture, at an angle of 30 degrees, and give a bold prick in the skin and vein, one assertive prick, and the cannula should go in the vein. And how will you judge that the cannula has entered the vein? You will get a flashback of blood. Okay, then you decrease the angle of the cannula to the skin and advance the cannula with the stillet inside. Now, while advancing the cannula with the other hand, you start pulling the stillet of the cannula outside, and then you flush to the attach the flush syringe to the cannula, and after that you release the tourniquet. Now this is just showing you the direction. The cannula has to be uh, sleeved inside, and the stillet has to be removed. The position will be like this, and after removing the stillet, you have to hold the cannula and block it with the finger till the time you attach a syringe here. And now dispose the sharp stillet into the bin immediately, and then you attach the flush syringe. Either you can attach the flush syringe and flush there and then remove the syringe, hold the vein, and cap it, or you can cap it, and if there is another port for injection, like here, in some cannula it is there, but in some it is not there. So if there is a port, you can block this with a cap, and then afterward fixing the hole of the cannula, you can inject the flush from here. Now see, the you have to secure the cannula with proper sticking. The ready-made stuff is available, or you can use a sticking plaster according to whatever the trend is in your hospital, and secure it properly. You should ensure that there is no leak, and also that the sticking plaster is firmly attached to the skin. If the skin is wet, you should first dry it up with a gauze so that the adhesive sticks properly to the skin. Now, this picture is showing the flushing of the cannula with the saline. If you don't flush, the cannula will. Now, it's very important to put the time and date, especially on the sticking plaster, of the cannula. Thank you.